Hey everybody, this is a clip from the latest episode of the Randi Rhodes Show. If you want the full episode, you can watch live on Free Speech TV, Dish Channel 9415, DirectTV 348, Sling, Roku, and AppleTV.
Mary had a little man.
The fault. We believe that all men are created equal.
To the magnificent mosaic that is America.
From radio beacon to radio beacon. I have a dream. Change has come to America.
Believe me.
Knock, knock. Who's there?
It's a figment of your imagination.
Randi Rhodes Show.
Turn up your mind.
That study was done in part funded by the Trump administration. It was funded by the National Institutes of Health and the University of Virginia. The Veterans Affairs Secretary Robert Wilkie was saying it's not a VA study, but Jake, it was done on VA patients. They looked at their medical charts, then they published these results, which they said found that hydroxychloroquine did not help coronavirus patients from being ventilated. It actually caused higher death rates, this study found. And while Wilkie is correct that this was not peer-reviewed and it was not published in a journal, it was funded in part by the NIH and the University of Virginia. So the president is there discrediting a study that his own administration partly funded on hydroxychloroquine as he is defending his use of it. One thing he didn't answer was whether anyone else in the room on his cabinet is taking hydroxychloroquine as well. We know the vice president is not. He denied it earlier and said his doctor has not recommended taking it, though he did come in contact with, of course, his press secretary who tested positive for coronavirus. And that was the reason the president cited there as why he's taking this drug, because his personal valet tested positive, he said, and also because he came in contact with the VP's press secretary. But Jake, it's just really notable to see the president there as he is defending hydroxychloroquine and saying that the only reason people are criticizing it is because he's the one promoting it, when you can see the results of a study that was in part funded by the administration that say it was not helpful for coronavirus patients.
They're experimenting on old black vets. Okay, this is such a throwback to the Tuskegee syphilis experiments, and apparently there's a cure for syphilis now. I remember when Bill Clinton had to apologize to the families of the Tuskegee syphilis victims. Okay, and here we are doing it again. And I love this phrase. Donald Trump doesn't like the results of the study that his National Institutes of Health paid for, that they conducted on our veterans in our VA system nationwide. And so now he deems it a Trump enemy study or a Trump enemy statement. The term the rest of America would use is facts. And that he's using veterans as hamsters, lab rats. He said, the one survey, the only bad survey, they were giving it to people who were in very bad shape. They were very old, almost dead. So wait a minute. Are we supposed to test drugs on people who aren't sick? Then you could say they weren't sick. We gave them hydroxychloroquine and they didn't get sick. I don't even understand this man, okay? Why would anybody take any advice at all about anything from thrice married, three baby mamas for 5 kids? I mean, I don't. He said it was given by obviously not friends of the administration. Does he really think that scientists stay up at night thinking of ways to hurt him? What is this victimhood thing he's got going on all the time? These men died because he experimented on them 30% of the time, while 11% of them, without getting the hydroxy, did not die. I mean, this is just so, he's such a sick, unbelievably freaky man. A false study where it was given to very sick people. Yeah, we're all trying to screw you by giving the drug to very sick people. We're all trying to screw you, is what we're doing here. Let me just tell you, there is absolutely no evidence that this drug works, okay? Just none.
There is no evidence. In the letter, I read the letter as well, it says the evidence for and against There is no evidence to use this prophylactically. There are studies that are being done to look at this right now for healthcare workers who've had significant exposures. Those studies will come out at some point. There are other studies that are looking at it as a treatment. As you know, Chris, you and I have talked about it, and those studies have pretty abysmal. They have not shown benefit, and they've shown some potentially significant harm, especially when it comes to the heart. So not good as a treatment. Evidence is there for that. As far as prophylaxis, no evidence to show that it works. So it's and the FDA has come out and said again, and I know you've talked to these folks, but said do not use this outside of a clinical trial, outside of a hospital, because there's just no evidence here.
There's just no evidence here, and yet they're still giving it. They're giving it to oh well, they were ready to die, and so what the hell? Who is this man, and why is he experimenting on our veterans while his VA secretary sits in this cabinet meeting and says, "Oh no, that wasn't a VA study. That wasn't us. We didn't." Yes, it was. It was the National Institutes of Health in tandem with the University of Virginia experimenting on veterans in the veterans hospitals across this country. Under an emergency use approval. This is his crazy right to try thing. It's his crazy right to try thing, and it's doing more harm than it is doing good. And he's sitting there saying, I take it, and we don't even know if that's true. We just don't. But there's no evidence that it works prophylactically. Here's a doctor on the VA study.
It's bizarre that the president rails on the study as if it's done by his enemies, because the actual study doesn't say anything negative about him at all.
Let's clarify some of the issues. The VA study studied the effectiveness of hydroxychloroquine in treating rather sick people. And it was not, as you said, a prospective controlled trial. And it is possible that the sicker patients received the more medication than did the people who were less sick. And therefore, these retrospective studies are a guide, but they are not definitive. And as you said, more careful studies are needed. Now, that said, the hydroxychloroquine is now being used in order to prevent infection. And there, the scientific basis is virtually non-existent. So it's an idea for which there is absolutely no evidence.
And he's just on the TV screaming about how great this is. Screaming. And the one drug that we do know is effective in shortening the length of time you are sick with coronavirus is remdesivir. And all of this hoopla about this other thing that has absolutely nothing, no effectiveness at all, no evidence to show it prevents, no evidence to show it helps you clear, no evidence that it does anything to keep you off of a ventilator. What the evidence shows, though, is that it causes other organs to fail, and you end up dying from that. So I don't know why I guess he just needs something to set. I don't know why he's not saying, hey, remdesivir will shorten the length of time that you're sick, and let's get that out the door. It's the only treatment we have that is shown to, it's kind of like Tamiflu. It just shortens the length of the flu. It shortens the length, the remdesivir shortens the length of your COVID. I don't understand it.